that is the fetal surface. এদিকে আছে, that is the maternal surface. Maternal surface is rough. It has fissures. The fissures divide it into cotyledons. There are roughly 15 to 20 cotyledons. Cotyledon মাঝখানে fissures থাকে that divide the basal plate. And on the fetal surface, you see the membrane, and there is centrally attached umbilical cord below the umbilical, and there is radiating umbilical veins from the umbilical cord. Okay, umbilical cord e ki thake? Okay, there are 2 arteries and 1 vein, that you should know. Placenta is a discoid hemochorial structure. Okay, we call it discoid because it is disc shaped. What is hemochorial? The chorion is constantly in touch with blood, so we call it hemochorial structure. Or weight hoche 500 gram. 500 gram weight ache and blood thake 500 ml. It is 500 gram of weight and it has 500 ml of blood. Thickness is 2 to 4 centimeter. That is the normal. If the thickness of the placenta is more than 4 centimeter, what do we call? We call it placentomegaly. So in which conditions there is placentomegaly? Diabetes, Hydrops Fetalis, fetal anemia and torch infections. Okay, why in diabetes there is placentomegaly? Diabetes er placentomegaly keno hoy? So not only that, because of higher insulin, okay, higher insulin secretion, that insulin will trigger growth factors. That growth factors will produce more cells, tissues, that will cause placentomegaly. Okay, tell me few conditions in which the placenta is small. That is not a condition. যেমন GDM আছে, tell conditions like that. GDM এর প্লাসেন্টা বড় হয়ে যাচ্ছে, যেমন ছোট প্লাসেন্টা কবে হয়? No. In IUGR and preterm babies, there is smaller placenta. Do you know how the placenta is developed? বলো, সব আনসার করেছিলিস, এটা বল। ব্লাস্টোসিস্ট থেকে সাইটোট্রোফোব্লাস্ট, হ্যাঁ, Okay, so very good. Ultimately, chorion fundosum and decidua basalis. Chorion fundosum is of the fetal part. Decidua basalis is of the maternal part. এই দুটো fuse হয়, we get the placenta. Placenta ultimately develops from chorion fundosum and decidua basalis. Okay, at birth, in the first month, the placenta is to fetal ratio is 6:1 at first month, and in 4th month it is 1:1. The fetus and the placenta, it is equal in size at 4th month. At term, the placenta will be 1 and the fetus will be 7, 1:7 ratio. So at first month it is 6:1, at 4th month it is 1:1, at term it is 1:7. What are all the functions? What are all the functions of placenta? Okay, so it has transportive function, excretory function, gaseous exchange, metabolic function, respiratory function, and nutritive function. Respiratory function মানে কি? What is respiratory function? So it takes place in exchange of gases, oxygen and carbon dioxide, because constantly from maternal side there is a uteroplacental circulation. There is uteroplacental circulation. From uterus to placenta blood jaচ্ছে. That is 400 ml per minute. Per minute there is 400 ml of blood. That is the normal uteroplacental circulation. Okay, and from there is fetoplacental circulation. আবার ফিটাস কাছে যাবে, আবার ফিটাস থেকে ব্লাড রিটার্ন করবে টু দ্য প্লাসেন্টা. So respiratory function হয়ে গেল, and it provides nutrition. It provides carbohydrates, it provides lipids, proteins, amino acids, and it transports small molecules like oxygen, glucose, active transport, facilitative transport, and it causes pinocytosis. ये सब किछु होय inside the placenta. And you should know about the hormone secreted by the placenta. What are all the hormones secreted? Placenta. HCG. HCG, what is HCG? Human chorionic gonadotrophin. In which condition there is more HCG? Normally when HCG pregnancy তে HCG বাড়ে. Pregnancy ছাড়া আর কি condition? Very good. Then in which conditions do we check beta HCG? See, normally giant cell tumor? No. Lump abdominal beta HCG can have. See, beta HCG is secreted from the syncytiotrophoblast. Syncytiotrophoblast that will secrete the hormones. Okay, so you must think in which condition there is more syncytiotrophoblast or trophoblastic proliferation. Which condition? Trophoblast proliferate হচ্ছে বেশি. ভাবো একটা নর্মাল প্রেগন্যান্সি আছে, on day 2 beta HCG is 150 to 200. In this condition, no, on day 2 it will be 2000. For example, I am saying after 1 week in normal pregnancy, if it is 15,000, in this condition beta HCG will be 1 lakh. What is that condition? There is trophoblastic proliferation, there is grape-like vesicles. তোদের ক্লাস হয়েছে কিন্তু কোনো লাভ হচ্ছে না. ইন মোলার প্রেগন্যান্সি ক্লাস হয় নাই? হয়েছে তো? হয় নাই? ইন মোলার প্রেগন্যান্সি দ্যার ইজ ট্রোফোব্লাস্টিক প্রলিফারেশন. ঠিক আছে, ট্রোফোব্লাস্টিক প্রলিফারেশনের জন্য বিটা HCG লেভেলটা খুব বেশি হয়. ঠিক আছে, আর কি কি হরমোনস? Human placental lactogen, relaxin, estrogen, progesterone, তারপর ACTH, adrenocorticotropic hormone, thyrotrophin releasing hormone, growth hormone releasing hormone, then thyrotrophin releasing hormone. এই সব কিছু প্লাসেন্টা থেকে প্রডিউস হয়. And placenta has the barrier function. What is barrier function? There is no mixing. Okay, there is a barrier between them. Blood placenta barrier. Only few things can cross the blood placenta barrier. Big molecules cannot cross. What and all can cross the placental barrier? Drugs like viruses, bacteria. Okay, then any IgG, IgM, which one? IgG, IgG will cross. Okay, IgM cannot cross because it is a big molecule. Which anti-immunoglobulin is secreted in milk? IgA. Okay. So now we will come to the abnormalities of placenta. What are all the abnormalities you know? Below beta. Huh. Okay. Bilobate or tripartite. Then suction churiata. What is suction churiata? Unequal halves. দেখো একটা বড় প্লাসেন্টা আছে, তার কাছে আরেকটা ছোট chunk of placenta is there. It is attached through membranes and blood. Yes, তাহলে একটা বড় প্লাসেন্টা আছে, একটা ছোট small chunk of placenta is there. We call it placenta suction churiata. What is the complication of suction churiata? No. No. Blood supply কেন কমবে? ঠিক আছে। ওকে, এটা একটা বড় প্লাসেন্টা আছে, ওর কাছে একটা নরমাল ছোট লোব আছে। ইট ইজ কানেক্টেড উইথ ব্লাড ভেসেলস। দিস ইজ দ্য কর্ড। ওকে, কি কমপ্লিকেশন হতে পারে? কি ব্লাড সাপ্লাই পাবে না? which part মানে কি মানে who will not receive blood supply? Fetus. Why? এই তো বড় প্লাসেন্টা আছে, will it not receive blood? So this is inside the uterus, it is attached. কি হবে? After delivery what will happen? Placenta will get expulsed. Yes, so ভাবো এটা বেরিয়ে গেছে কিন্তু এটা থেকে গেল, কি হবে? There will be the most commonest complication is PPH, secondary PPH, because there is a retained product, retained tissue that will cause bleeding. Okay, and it will cause infection, it will cause subinvolution. Then next আর কি আছে complications? না আর কি types of placenta আছে? What is battledore placenta? This is suction churiata. Placenta suction churiata. What is battledore placenta? বলো। Normally the cord is attached to the center. Okay, in battledore placenta the cord is attached to the rim at any edge. ঠিক আছে, normally it is attached here center, but in battledore placenta একটা corner এ attachment হয়. So what will be the complication here? No idea. Okay, see, normally if the placenta is attached here, okay, if cord is here and the cord is here, কি হবে? Can you imagine? কি blockage? Baby's head will come here. Okay, that will cause compression of cord. If it compresses the cord, নিজের blood supply কমে যাবে. Okay, it will cause preterm delivery, it will cause IUGR, it will cause stillbirth, sudden death of the fetus also. This is called Blattledore placenta. Anything else? Placenta accenta. What is placenta accenta? Placenta accreta. ওকে, ওটা লাস্টে বলবো। আর কিছু টাইপস অফ প্লাসেন্টা বল। বাপরে। What is circumvallate placenta? Circumvallate. Circumvallate placenta বাইরে একটা রিম থাকে। There is a rim. In cross section you will see like this. Okay, this is the rim. What is this plate called? This is called chorionic plate. This is called decidual plate. This is chorionic plate. Above the chorionic plate there is another fold of chorionic plate that will form a rim around. This is called circumvallate placenta. Okay, what is placenta accreta? See, after fertilization, okay, zygote form হয়ে গেছে। There is a zygote, okay. Zygote, what zygote will happen? It will get cleaved. It will মানে একটা 2 cell হবে, 2 cell থেকে 4 হবে, then 8, then it will go into 16 cells. 16 cell stage is called morula. It is called morula. Okay, 16 cells. Okay, this morula, it will try to go and have implantation. Before implantation, morula te ekta change hoy. What happens is it gets swollen. Bhitore fluid chole jay. Okay, and there are cells here. This is called blastocyst. This blastocyst, what it will happen? Endometrial layer ache. Okay, what are the layers? বলো। এন্ডোমেট্রিয়াল বলছি আবার মানে মায়োমেট্রিয়াম কোথায় যাচ্ছিস তুই? This is basal layer, this is functional layer. Stratum basalis, stratum functionalis. Okay, মানে এই পার্টকে আমি কাট করে এরম দিয়েছি। This is the deeper part, this is the superficial part. This blastocyst, it will come এর ভিতরে চলে যাবে like this. Okay, this is functional part. Blastocyst এখানে এসে বসে যাবে। বসে যাওয়ার পরে কি হয়? This blastocyst, it will turn into something called this মানে এখানে পুরো সেলস আছে। This is inner cell mass, this is outer cell mass. Okay, this inner cell mass will produce what? No, inner cell mass will produce ectoderm, mesoderm, endoderm. Outer cell mass will produce this cytotrophoblast and সিনসাইশিওট্রোফোব্লাস্ট, ঠিক আছে। এখান থেকে ওই সাইটোট্রোফোব্লাস্ট মানে হোয়াট ইজ সাইটোট্রোফোব্লাস্ট? সাইটোট্রোফোব্লাস্ট মানে ইট হ্যাজ এ সেল ওয়াল, সিনসাইশিওট্রোফোব্লাস্ট মানে ইট ডাজন্ট হ্যাভ সেল ওয়াল, ইট ইজ লাইক amoeba with nucleus, বাইরে সিনসাইশিওট্রোফোব্লাস্ট আছে, ভিতরে সাইটোট্রোফোব্লাস্ট আছে, ওকে। এখানে normally what should happen, this placenta will form here and it will not cross this basal layer, okay. There is a layer called Nita-Busch layer, Nita-Busch, Nita-Busch layer. It will prevent penetration of the syncytiotrophoblast inside the basal layer, okay. For example, if this layer is not there, এই লেয়ারটা যদি না হয়, it will penetrate inside. So what will happen? Penetration বেশি হয়ে গেলে কি হয়? Normally this layer is shed off. Even when you are menstruating, no, only this layer will shed, basal layer will remain, functional layer is shed off. If this penetrates the basal layer and if it goes inside the myometrium, we call it obstetrician's nightmare, placenta accreta. That is placenta accreta, increta and percreta, okay. Accreta mane it is invaded the endometrium, invaded the endometrium and gone inside the myometrium, accreta. Increta mane it has penetrated the myometrium also. Percreta আছে, percreta মানে সামনে ব্ল্যাডার আছে, পিছনে রেকটাম আছে. Placenta will go outside of the uterus and it has reached the bladder also. Pichane it will reach the rectum also. That is percreta. So usually after delivery, placenta will, what will happen? Placenta will get delivered. But placenta accreta te ki hoy? Deliver hoy na. It will get stuck to the uterus. It will get attached to the uterus. So what will happen? There is again ki hobe? PPH hobe. So in that patients what we have to do? We have to do hysterectomy. ঠিক আছে? Okay, then আর কি কি কমপ্লিকেশনস আছে? আর কি abnormalities আছে for placenta? There is something called velamentous insertion of cord. What is velamentous insertion? I know this is a little boring class. Velamentous insertion. See, normally cord is attached to the center, okay, and there is membrane here. In velamentous insertion, what happens? The cord is attached to the membrane, not to the placenta, okay. Membrane, it is attached to the membrane and it is not attached to the placenta. What will happen? It has just touched the membrane, no, during delivery easily ছিঁড়ে যাবে, it will get torn. That will again cause what? It will again cause PPH or it can cause APH also. What is placenta previa? Placenta previa is, placenta previa কি complication হতে পারে? ভাবো uterus আছে, baby's head is here and if the placenta is here, we call it placenta previa. Placenta previa কি complication হতে পারে? Placenta previa is a cause for APH. ঠিক আছে, placenta previa and abruptio placenta. There are two causes of antepartum hemorrhage, that is placenta previa and abruptio placenta. ঠিক আছে? বল, what are the complications? No, again the baby's head will compress the placenta. Placenta ke compress korle blood jabe na to the baby. It will cause insufficiency. Yes, baby hypoxia hobe, stillbirth hote pare. মানে so we don't allow if there is central placenta previa মানে একদম সেন্টার যদি থাকে we will not allow it for cesarean section. Sorry, we will not allow it for normal delivery. We will go for cesarean section. ঠিক আছে? Okay. আর কিছু বেশি কিছু নাই. Okay. Now I'll just ask few random questions and we'll finish the class. Okay. What is the weight of the placenta? 500 grams. Placenta কত blood থাকে? 500 ml. What is the diameter of placenta? 15 to 20 centimeter. I didn't say this. Yes, it is 15 to 20 centimeter. What is the thickness of the placenta? 2 to 4 centimeter. We call it a hemochorial structure. Discoid hemochorial structure. Why? Disc shaped, and it is the cotyledon is constantly in touch with the blood, so we call it hemochorial. দুটো সারফেস কি আছে প্লাসেন্টাতে? একটা ফিটাল সারফেস আছে, একটা ম্যাটারনাল সারফেস আছে। কত কটিলেডন থাকে? 15 to 20 cotyledon থাকে। What are all the layers? Do you know? Placental layers আছে। হ্যাঁ, see from the fetal part to the maternal part কি কি লেয়ার আছে বলো? ট্রাই করো। ফার্স্ট কি মেমব্রেন আছে? fetal part, this is fetal part. কি মেমব্রেন আছে? what is that membrane? that is amnion. amnion এর নিচে কি আছে? chorionic plate, cp. I wrote no, cp, chorionic plate. তারপর choriodecidual space which has the villi. choriodecidual space. After choriodecidual space there is extraembryonic mesoderm, syncytiotrophoblast, cytotrophoblast. Then basal plate. Basal plate. Then comes the uterus. What are all the functions of placenta? Excretory function, transport function, nutritive function, hormonal function, barrier function. Therefore, you should know about all the abnormalities of placenta.